You're welcome. What if I told you that the decisions we make aren't always based on logic, but rather on what we see others doing? Think about it. When choosing a restaurant, you are more likely to go where it is crowded. For example, when I'm going to get some dry meat and pap, I'm likely to go to places where there are a lot of people there queuing, waiting to be served. So in most cases, what happens when we want to seek services, when we want to go in and access certain kinds of service, we are bound to go to where we see a lot of people. If it's a restaurant, some of us, we go to those restaurants that are packed. So we look at these places and then we decide and say, most likely there's likely to be good food. That's why a lot of people, they are queuing outside. Most likely there are good vibes in those particular places. That's why there are a lot of people there. When deciding whether to get tested for TB, the same principle applies. So there are certain things that happen in business, but they also apply in the public health space. So if we see that our peers are getting screened, our colleagues, our friends are getting screened, we are more likely to do the same. So that is actually the power of what we call social proof, where we are using the group influence to encourage action. And it is very key for us to touch on those particular aspects, such as social proofing. And then at the same time, there's something called priming. So these are subtle shapes of behavior by setting the stage for decision before even we make them. Imagine you're walking into the clinic and where there are posters highlighting the success of TB treatment, or you're hearing on the radio an ad that actually reminds you of a friend who recently got screened. And these small cues influence our choices in a big way. So today, we are going to be exploring how social proofing and priming can actually transform TB messaging, making screening and treatment the natural and easy way, and also the expected choice from the communities. So we are going to be diving deep into these aspects of social proofing and priming. But as a starting point, let me say, what exactly is social proofing? So social proofing is actually a psychological phenomenon where people copy the actions of others in an attempt to make the right choices. Like I said, when I see that others are flocking into a restaurant, of course not a restaurant, it's a chisanyama, and I see that it's a packed chisanyama in the community, I'm bound to go there and then have some as well, because I can see, the fire and the smoke. But if I see that it's scanty, there are not so many people, I'm likely not to go to that particular lady who's frying the meat there. So why does it work? Is because humans are social beings who rely on the behavior of others to decide on what they will be doing. So, for example, in everyday life, choosing a restaurant because it's crowded, it's a typical example. In some cases, it's around shopping. Some of the shops that we go to, small streets, we flock in because the prices are a little bit lower. Then we flock in there to go and buy our t-shirts. When we see that there is a vibe now, people going into that particular shop, we are bound to go there and select whatever that we select, we dash out Because we can see that most people are flocking in this particular direction. So that is what the concept of social proofing centers around. So then the other aspect is around the fact that why it's important for civil society forum leaders to know about social proofing and priming in TB messaging. Why is it so key and critical for civil society organizations to know about this? 100% sure it enhances community-led TB interventions. That is one thing that is guaranteed and 100% sure to say that through CSF leaders, civil society organizations mastering this aspect of social proofing and priming, they are going to enhance the manner that they come up with community-led TB intervention. Because civil society play a crucial role in mobilizing communities for TB screening, for treatment, and even prevention of TB. Not only in the TB space, you find yourself, like for example, in the climate change space, you find yourself in the GBV space, you find yourself in the access to justice space, in whatever space that civil society organizations or sectors they find themselves in, and whatever messaging they want to drive. If they would understand the concept of social proofing and priming, they would come up with better and tailored community-led interventions. But over and above that, the second component, it's around leveraging social influence for prevention. For example, the people are more likely to act if they see others doing the same. So which means we are tapping into that part of saying that when people see others flocking in a certain direction, they are more likely to do what others are doing. So CSO, civil society organizations, can amplify positive peer influence by showcasing real stories of TB survivors. Because these TB survivors, they begin to narrate lived experiences that they would have gone through in this particular process. This could be community health workers narrating lived experiences, or local leaders narrating lived experiences. So they will be advocating for screening, for treatment, for adherence to treatment. So that way it becomes that social influence that they give to the programs that we're implementing. So most people in the community have completed their TB treatment. This could potentially be a message that gets to be utilized in driving health messaging to the communities. Where we are saying, did you know that most people in this particular community have actually completed their treatment and they are living healthy lives? So that could prompt people in the direction of understanding that, which means in this community, there are a lot of people that are on this treatment and they've all been adherent and they are living healthy. And those are key aspects that as civil society organizations, we need to know about and we need to keep at the back of our minds as we craft our messaging. Then of course, the third component is around the reduction of stigma through social norms. So in this particular case, it could be stigma remains a major barrier to TB diagnosis and treatment adherence. So social proof helps normalize TB screening and treatment by making it more widely acceptable and also an encouraged behavior. So which means in the communities that we serve, the more we get to have positive testimonials from TB survivors, from TB ambassadors, we are likely to drive localized change. We are likely to drive an increase in uptake of certain services within our communities. So it is very key for us as community-based organizations to make it a point that we make use of these two aspects: social proofing and priming, particularly in TB messaging, because it's bound to drive change in our locality. Because as we do our day-to-day work, we find ourselves in situations where we need to come up with messaging. We need to come up with sustained change in our communities. And for us to do that, we need to be conscious in terms of how best we can do this. And also, we need to begin to think, what are the types of these social proofing that we can do in the social behavior change communication space? So I'm just going to touch on 5 types of how we can do the social proof. So, number 1, we could use expert social proofs. So experts, these are like endorsements from, say, public health specialists, from maybe trusted figures in the community, from the chiefs, like saying that the chief recommends LTB screening, or the premier recommended LTB screening for our safety. So it brings that endorsement where we bring in political figures, we bring in doctors. So they are viewed as experts in a certain area. In some cases, it could be using celebrities. These could be influencers. It could be an influencer at a school, at a college. It could be some famous personality that we have in our community, or some granny who's in our community who is well known in this particular community, who has been serving this particular community. It could be a TB ambassador who is well known in the community, where we say David Makana got screened for TB. So those are some of the aspects where we can use a certain celebrity and a certain expert in this particular space. Now, the third component, I think I've touched on the expert, the social proof using an expert, using a celebrity. The third component is about user social proof, whereby we begin to give personal stories, testimonials from the community members to the community members, where we begin to talk about, I completed my TB treatment and I feel healthier than ever. Just that particular messaging and people seeing my face out there, it begins to give a certain narrative where, as a user of a service, I begin to talk about my experience. And then in some cases, we could potentially use wisdom of the crowd. So this is messaging that emphasizes how many people have taken action. Wisdom of the crowd, the bigger community. So when we talk about 80% of the people in our community have already been screened for TB. So it gives an impression that out there, you might be the only one who has not been screened for TB. So you begin to ask yourself, am I part of the 20%? I need to go and join the 80% on the other side. So it begins to drive that hunger and thirst for community members to come through and be screened for diabetes, or be screened for TB. So, in some cases, I said wisdom of the crowd. Let me put in the fifth component, which is wisdom of the friends. Using personal networks to encourage behavior. Your neighbor, John, your neighbor, Lirato, got tested for TB. Join him in protecting your health. So those are typical examples of where we could use social proofing. And it is key that as community-based organizations, as civil society sectors, we take a leading role in identifying some of these experts in the communities, in identifying some of these key personnel in the communities, who could be part of driving this messaging. The National Department of Health is currently doing a drive. The National TB program is actually doing a very brilliant drive where they are getting people that have got lived experiences to tell their stories and showcase the work or showcase their experience that they've had from diagnosis up until completion of the treatment, up until them having healthy lifestyles. And those are the kinds of programs that as civil society organizations, as community-based organizations, we need to go out there and promote. We need to go out there and showcase so that we provide support to recently diagnosed individuals, to people that have not yet been diagnosed, to people that have started treatment, and those that have not yet started treatment. So we sensitize people in the communities. So I've spoken a lot about social proofing. I want now to jump to priming, an interesting concept. So priming is actually around the use of subconscious cues to influence decision making and behavior. So basically this is how it works. So you get exposure to certain stimuli that makes individuals more likely to take a specific action. For example, in health facilities, if you, by placing TB awareness posters near clinic waiting areas, it actually primes people who are in that particular queue to end up considering TB screening. In some cases, when they go inside the facility, or they go inside the booth, or they go inside the consultation room, they end up asking for that particular service, or they end up asking, say, I would also want to be screened, tell me more about this. They become curious. So that's what priming does. It actually hits on us on the subconscious. It gives us some of the cues to influence decision making and behavior. And this is quite common, of course, in the private space, in retail shops. You find that they play some soft music. Of course, they play some soft music in stores to encourage shoppers to take their time and buy more. Of course, there are variations. In shops where you're going to spend a lot of money, they play some soft music so as to encourage you to buy more. And then in some cases where they play loud music, and then you get those vibes, and then you enjoy that music, you start dancing to it, and then you find yourself staying in that shop for a longer period of time, and then you keep on buying for 10 rands, 20 rands, 50 rands, 100 rands, 200 rands. You end up finding yourself staying there for a little bit longer in that particular shop. Actually, maybe hospitals and clinics should have considered playing music inside, Maybe even the loud noise of the children crying was not going to be that much, because there's gonna be some music, some ambience, some slow music that gets to be played. Maybe they should put DJs in some of these areas, especially when it comes to youth-friendly corners. What do you think? A comment in the section below. So basically, priming talks to aspects to do with some of these subconscious cues that they come up with, where they come up with these ideas of saying, they get you to get a feel of the environment, to get a feel of what is happening, the surroundings, they are conducive, and then you keep on paying more money, and then you're comfortable there. Or they put stickers. In some cases, companies will keep on putting their logos or their adverts in strategic places, and then you get to be repeatedly exposed to that kind of messaging, and then over time, psychologically, you get to internalize that, and then you act on instinct when it comes to it. For example, in some cases, some companies would brand tables or they would give you, that thing where they give you a calendar so that you keep on seeing their logo. And then one day when you make a decision to go and buy, you end up finding yourself queuing in that particular place, and you wonder, but why is it happening like this? In some cases, we prime ourselves, I think, like when you decide to say, I want to go and buy a certain car, you begin to see that particular car. I'm not sure whether that's priming or not. But, there's a part to do with priming and social proofing that needs to be applied also in our community settings. So, when you look at these strategies, social proofing and priming, so both of these strategies, they leverage, they take advantage of human psychology. They take advantage of how we think things through, so as to make healthier behaviors feel more normal than, more normal and actually necessary. So people generally, they fear being left out or being left behind, FOMO, fear of missing out. So generally people have got that element in them. So social proof makes TB screening feel more like the norm, while priming ensures that the right health cues are actually placed where they are more visible, and in locations that could have more impact. So we make it a point that if you are to have any health cues or any aspects that you want to use them to trigger people to behave in a certain manner, they are strategically positioned so that we begin to associate, to see them, and then when we go in to the facility, or when we go and seek, say we begin to, to say, hey, I want to be screened for TB as well. Why is it that this and this is happening? How come I'm also, I would also want to, I think I might also need this particular service. So there is an aspect to do with the actual use of social proofing in TB messaging. So this social proofing could come in the form of maybe some of these public commitment campaigns, like this 1 million campaign. It could be one of those real campaigns that are happening where we are encouraging people to share their TB screening status, or we are encouraging people to go and seek health services. Go get tested for TB. You should too. I got tested for TB. You should too. And these could be maybe stickers that we put, or these could be boards, or it could be stickers on cars, or it could be something that we put on TikTok, on our profile on TikTok, or it could be something that we put on your WhatsApp status. So in some cases, when it comes to this thing of social proofing, we could be having real-time data sharing. That is why data is very important in the civil society space, where we begin to display community-wide statistics. I know in some of these clinics, you would find statistics being on the notice board, but most people, they don't normally look at them. But it would be good to find ways through which we strategically show some of these statistics in health facilities so that people can read those statistics, or we make it much more visible. But we pick on key statistics. In some cases, it will be on social media, where we begin to have snippets of these, statistics, snippets, bits and pieces of these statistics of what is happening in our communities. Like we can say 95% of TB patients at this particular clinic have successfully completed their treatment. So it's coming from a positive angle where we are sharing that particular data. In some cases, we can even have community-led messaging where we're using peer influencers to spread TB awareness. For example, we could potentially use community leaders to encourage TB testing. You know, where we say, let's follow our leader, let's follow our premier as they go for TB testing or TB screening. So that way we begin to give an impression that generally out here, a lot more people, they are getting screened for TB. So, the other aspect that I've spoken a lot about, social proofing, the other aspect that I want to talk to is actually priming in the context of TB. So priming, it talks about the clinic layouts and posters. So this could potentially be the general layout of this particular clinic, where we're placing TB screening reminders, you know, in waiting areas, where we've got posters in waiting areas saying, you know, most people here have been screened. Have you? In some cases, we could have cues in digital messaging, where we're using familiar faces or local role models in TB awareness campaigns. So we could be using, you know, some of these familiar faces that we are having in our local communities. And then we've got a WhatsApp message that would say, did you know 9 out of 10 people in your area completed their TB treatment successfully? Okay, so that could potentially be a message that gets to be flighted. It could be on WhatsApp status, it could be a WhatsApp message, it could be an SMS. And then I think I've spoken about the clinic layout and some of the posters. I've spoken about some cues, some digital cues, some messaging that comes via our social media platforms. And then the third component, it could be visual and environment triggers. So this could be color-coded signals. Some cases it could be floor markings that direct people towards certain spots without driving stigma. In some cases, it could be the green footprint, which drives people towards a certain direction for integrated health service provision, where it's not just TB, it's all the other services that are provided at those particular spots. And then people would then ask themselves, why are people going in this direction? Oh, this is for access to integrated health services. This is the direction that people are going. So I must say that at the present moment, there are lots of platforms that have been utilized to ensure that social proofing and priming are effectively applied. For example, within the civil society space, we have got the law and human rights sector that has set up some WhatsApp groups, and they're doing WhatsApp group campaigns that are targeted at men. And they are doing health education in those particular groupings. And also, I know that in the West Rand area also, in Gauteng, there's some work also that they are currently doing where they're setting up WhatsApp groups that are targeted at men. And in those particular groupings, they will be throwing in some priming, messaging, repeatedly exposing community members, men in those groupings, to certain type of messaging, so that they will be sensitized, and then they would have that drive to go to the health facilities. And all of those interventions, they are key and critical in our day-to-day activities. So as civil society organizations, it is key that we come together. We identify opportunities to apply either social proofing or priming in our day-to-day work. We need to come up with strategies as we engage with the communities, as we hold our community dialogues, as we head towards World TB Day. as we come up with interventions, we need to come together and say, what kind of messaging can we package through using social proofing or priming, or through using any other methodology that is out there that is targeting at driving social behavior change communication. Like I always say, if you need any support, please reach out to us in the comment section below. We are going to reach back to you. If you've got any brilliant ideas, any brilliant messaging, or any groupings that you are having where you would want to begin to craft the messaging, please reach out to us. We might not have all the solutions to your problems, but we'll come up with the possible best health solution. So, thanks a lot for watching, and stay tuned. We'll be bringing out more and more videos on social behavior change communication and some of the best practices in the public health space.